All right. Hello, my name is G. Today I'll be presenting my three questions for project number one. So here's my three questions. These reference you're seeing in my PowerPoint slide will be listed towards the end of the PowerPoint with the APA style. Right now I'm just using the in-text citation style for dissertation and thesis, just to keep everything more clear. All right, so question number one, why does hydrocodone stop working over time? So, opioid addiction develops because the brain gradually adapts to repeated opioid exposure, eventually leads to tolerance, dependence, and of course, continued drug use. This figure shows how hydrocodone, one of the pain medication mentioned in the video by the gentleman who was playing golf, showed how hydrocodone affect the brain and why it become less effective over time. So if you look at the figure over here, the opioid here will be representing hydrocodone. Hydrocodone binds to the microopioid receptors, which is right here, MCLS, in the brain, particularly in the region involved with reward and motivation. It's also known as the ventral tegmental area, VTA for short. So the dopamine produced neurons in the VTA uh, are normally controlled by GABA, which is right here, um, which acts like a brake, a stopping mechanism on the reward system in the brain. When hydrocodone activate opioid receptors, it reduces the GABA, like the down arrow over here, reduce the GABA activity and then removes this brake. So now there's no stopping. As a result, dopamine release in the brain's reward pathway. So this dopamine surge will eventually produce the feeling of pleasure, rewards, and euphoria, making the drug experience reinforcing and increase the likelihood of repetitive use of opioid drugs, in this case, hydrocodone. So, however, when continue opioid use, the brain begins to adapt. Opioid receptor become less responsive, and dopamine signaling become less effective. Because the change, the same dose no longer produce the same effect. This process is known as a tolerance clinically, also known as drug tolerance. The individual often require larger or more frequent dose to achieve the same level of pain or euphoria. Over time, chronic opioid exposure also will activate the stress pathway, which is on the right side of the pathway diagram. And instead of taking the drug primarily to feel good, many individuals continue to use to avoid withdrawal symptoms such as anxiety or discomfort. Therefore, addiction is not simply like a lack of willpower. It is driven by a long-term change in both the reward system and also the stress system. Those neurological adaptations explain why hydrocodone become less effective over time and why stopping opioid use can be so difficult. So question number two is, why does crushing the pill make it feel stronger? Um, the answer comes to really like two concepts, pharmacokinetics and pharmacodynamics, uh, short for PK and PD. So PK describe how drug moves through the body, while PD describe how the drug produce effect once it reaches the target receptor. Look at the graph on the right. So we have hydrocodone in powder form in fine particle size at 60 milligram and in coarse particle size at 60 milligram. So this happens when crushed pill increase the surface area, allowing dissolve and absorb faster. This process is described by the PK equation below, uh, a concentration over time, which is a very simple differential equation that describes the concentration increase, the dynamic of the concentration over a function of time. So here we see the larger your pKa, and then the far faster you will see that concentration spikes. Another important parameter is the Ka, which is on top over here. When the pill is crushed, the absorption rate increase, cause the concentration curve to rise faster, we reach a peak, which is like here. You see the powder format. The PD equation, on the other hand, that links the drug's concentration to drug effect. So that's the stronger component. As the concentration increase, more receptor become activated, leading to a stronger physiological response. In the brain, when you have a activated the opioid receptor, increased dopamine signaling within the reward pathway, and that gives you more stronger feeling of after you ingest the drugs. So the same mechanisms that produce stronger high also increase the risk. So like rapid increase in drug concentration are associated with a greater addiction potential and also stronger reinforcement and of course higher risk of overdose. And so now we talked about just some basic of opioid, how the mechanism work with the example of hydrocodone in question one, how the drug does to the body, how the body reacts to the drug in question two. And then here comes to my question three, how can opioid drug do less damage to our body? How can we protect ourselves, right? So it comes down to how can we chemically engineer safer opioid through a maybe a more selective mechanism biochemically. So instead of fully eliminating opioid, a lot of the research going on right now are exploring the pathway to make it actively only at the site of injury. So in this case, we have three opioid over here on the upper right, the morphine, your oxycodone, the hydrocodone. Um, and then so when we're looking at those chemical structure, we see they all contain a amine group, right? So the So this is when the group become positive. When those amine group become positively charged, the drug can bind to that microopioid receptor and produce pain relief. However, when you a lot of time when those painkiller medication being used in clinical scenario, they're actually trying to target a tissue that is more acidic because those are inflamed tissue or injured tissues at the site. The injury is causing the pain. So what people found out is research found out is the tissue injury site a lot of time is very acidic. So instead of using the standardized amine attached opioid chemical molecules, you can actually conjugate a fluorine to the opioid to make it more sensitive to the acidic environment. So it become activated only when the pain medication goes to the injury site. So the experimental study have shown that fluorinated fentanyl and morphine analogs have promising result, maintain a still the effect, but because they're sensitive to the injury site, when they're only releasing when they get to the injury site. So to make it less damage to our body, we can biochemically modify it to make it potentially less, have adverse side effect like your typical standard opioid, or which eventually cause addiction. So this may lower the addiction and also some of those respiratory depression risks. So here's my reference, and that will be the end of the presentation today. Thank you.